Leukemia, how is it diagnosed?
So when it comes to patients who we suspect having leukemia, from start right up to getting a complete diagnosis usually takes about 3 to 5 days. The first thing that we do is we take a very detailed history. We ask them for symptoms that suggest anemia, for example, whether they have any fatigue, generalized lethargy, palpitations, and so forth. We also ask them whether they have got any history of recurrent infections to suggest whether they have got low white cell count, and also about history of any bleeding due to the low platelet counts. Once we have got a detailed history, and we go about doing a complete physical examination. We examine the neck for any palpable lymph nodes. We check the abdomen to look for any enlarged liver or spleen. Once we have got a detailed history and a complete examination, we proceed to do the blood test. We start off by doing a full blood count to look at the hemoglobin levels, which we may expect the hemoglobin levels to be a bit low. At the same time, we check for the white cell count. Here, the problem is due to the production of the white cell count. The next is we look at the platelets. Patients with suspected leukemia will have reduced counts of platelets. We then proceed to do a peripheral blood film. We take the patient's blood, we smear on a glass, and we look under the microscope to look at the morphology of the cells. We are looking for any abnormal white cells to see whether they are suggestive of cancer-looking or blast-looking or leukemic cells. Next, we proceed to do more extensive investigation, which includes a bone marrow examination. We do a bone marrow aspiration and a trephine biopsy, where we put in a bone marrow needle into the posterior superior iliac spine, which is part of the hip bone, and we extract a small amount of blood from the bone marrow. We take this sample and look under the microscope at the morphology of the cells. We look at the size, the shape, and for any abnormal cells. We use the aspirate to do a molecular testing as well. We check for the cytogenetic abnormalities. We can do the conventional karyotyping. We look for any abnormal chromosomes that is the driver to the leukemia. Other methods include FISH, which basically translates to fluorescent in situ hybridization, where we are looking for abnormal genetic cells that are driving leukemia for this patient. There are certain patients that we actually proceed to do other imaging studies, for example, a CT scan or a PET-CT scan if we suspect there's any dissemination of the leukemic cells. For patients who we suspect involvement of the central nervous system, we proceed to do a lumbar puncture where we collect the cerebrospinal fluid and to test for the presence of leukemic cells in the brain.